Okay, good afternoon, everyone. Welcome to the electronic visit verification public meeting. This is Friday, September 23rd. It looks like we still have some people joining, so we're just going to give it another minute or so for the rest of the people to trickle in, and then we will get started. Thank you. Okay, I think we're going to give it just one more minute for people to join, and then we will get started. Okay, good afternoon, everyone. Welcome to the Friday, September 23rd, 2022 electronic visit verification public meeting. Just some reminders for this afternoon. All of our phone lines are muted. If you have any questions, please put them in the chat feature. And if you put them in the chat, please reference your slide number that you have a question on so we can use that information when we go and back and look at it. We're not going to be answering any questions during today's presentation live, but we will be collecting questions and comments through the chat, and we will look to put an FAQ out on our EVV website after responses have been compiled. Okay. So some things on our agenda today, we're going to talk about our alt EVV recertification or certification for providers who were not previously certified. Some general EVV program updates, including some information from our HHA exchange vendor, our home healthcare services EVV implementation, some EVV reporting capabilities that are new, some general reminders and updates, EVV personal care services manual edit compliance. We have a couple of new frequently asked questions that we'll share with you. We'll go over our EVV contacts, and we have a few slides from our SAN vendor as well. Okay. So in terms of our alt EVV recertification and certification, all of our Pennsylvania vendors have been recertified in accordance with our updated technical specifications. So any new Pennsylvania vendors will need to contact SAN in order to initiate the certification process. Some general reminders. If you want to look at the current technical specifications, they are available on our DHS EVV website, and they are on the right-hand side of the page. So if you are a new provider to the Department of Human Services within Pennsylvania, our EVV program, who is not intending to use the SANDATA EVV system, you're going to want to go to our DHS All EVV webpage and fill out the DHS Home Health Alternative New Provider Registration Form. Now, this form should be used by all providers, even if you're not a home health care provider. But as long as you're subject to EVV, you want to fill out that form. So that form is available on our provider billing page. And we have our cookie crumbs here. If you click on EVV resources and third party or alternate EVV technical specification documents, it's going to be over there. So this form is going to initiate your agency to receive their credentials to the DHS aggregator. Once you've completed the form, you will receive an email response providing your agency with the next steps to receive your agency's credentials. So also a list of EVV vendors who have previously completed certification is available on our EVV website for providers who still need to find an all EVV vendor. Okay, another general reminder, our Bureau of Program Integrity is still continuing to monitor all providers in their EVV submissions. So we had a presentation in June from our Bureau of Program Integrity, and any questions, please look back at those slides from the last public meeting in reference to that. We also have more information available on our EVV website. Okay, so some more program reminders. Be sure to review our alternate EVV technical specifications and our quick reference guide vendor credentialing documents, which are on our website. And the SANDATA alternate EVV error handling overview and reference guide has been updated as of March and is still available and accurate for all providers to download and review. Okay, more good information for everyone to have. Our DHS aggregator has read-only views and read-only reporting to help you monitor all the visits that your vendor delivers for both personal care services as well as home health care services. Our DHS aggregator compiles the visit data for provider agencies to review. As a reminder, the DHS aggregator does not submit claims. And the DHS aggregator is validated against during claims processing when an EVV service is found on the claims transaction. So all billing processes are continuing as normal. We have some updated information that's helpful to share with you all from our HHA exchange provider. We've discovered some providers who are having issues with duplicate visits with different visit IDs. So there have been identified that providers have entered some duplicate visits in HHA exchange with the same member, same caregiver, same times, etc. The current configuration in HHA exchange allows providers to enter such visits, and this configuration was decided upon by HHA exchange and their customers many years ago before our Pennsylvania electronic visit verification aggregation was being enforced. So HHA exchange has communicated to providers to update and correct any duplicate visits to prevent this from happening. In the meantime, they're also working with their client success team and the managed care organizations to revisit the details of this configuration moving forward. Now we will have from our PADHS, we will have some updates on error status codes specific to duplicate visits in the future. So please keep that in mind. Okay, so the Miss Sandata deployment on August 12th, Sandata had formal implementation of the updated technical specification changes, and HHA worked to become certified, work with Sandata to achieve all their milestones. However, an error was discovered, which led to visits being rejected for error during retrieving service or service ID entered. And HHA Exchange has reprocessed all of the affected visits and are waiting for the last remaining records to be updated with the status. So they're going back and forth and they're reprocessing. I know providers have been frustrated, but HHA Exchange has been working with the managed care organizations, with Sandata, and with DHS to try and get these resolved so they're as accurate as possible. Okay, one more point from HHA Exchange, updating data from electronic visit verification to manual. After several discussions between Sandata and HHA Exchange, it was realized that visits with manual confirmations were not being sent according to their specification changes. So due to this, HHA Exchange is going to reprocess all manual visits from January 1st of 2022 through August 12th of 2022. The visits after August 12th of 2022 are being sent as expected because this issue was caught and addressed during the spec changes that occurred effective August 12th. So HHA Exchange's development team is working on reprocessing those visits, and more information will be provided by HHA Exchange once this is complete. Okay, let's talk about our home healthcare services electronic visit verification implementation. As a reminder, the 21st Century Cures Act mandated that states implement EVV for home healthcare services before January 1st of 2023. The soft launch for this began on August 10th, 2022. This means that home healthcare services electronic visit verification error status codes are setting, but they are in a pay and list disposition before January 1st of 2023. For claims that have home healthcare services during this time, during the soft launch period, MMIS will perform validation against the EVV aggregator to determine if the information submitted on the claim matches the EVV PCS or home healthcare services visit data stored in the EVV aggregator. However, EVV error status codes will set without impacting claim payment. During this soft launch period, the claim will continue to successfully pass DHS EVV validation and process through the normal claims adjudication process. As of January 1st, 2023, claims will be impacted because there's not going to be any more pay and list dispositions. Okay, for our home healthcare services, some error status codes that you could see come across are ESC 935. That means that your home healthcare services visit was verified, and that's the code that you're looking for. That means it was successful. An ESC 936 is going to mean that there's a duplicate matching EVV home healthcare services visit found. This is not currently active, and we're looking for a deployment date on this in January of 2023. So if you are seeing for your home healthcare EVV services that you have an ESC 937, this means that home healthcare services units billed exceed the units verified in EVV. And if you get an ESC 938, it means that there's no matching home healthcare services EVV visit found. Okay, so more home health care services, EVV implementation information for everyone. September 20th, 2022, the Department of Human Services in Pennsylvania applied for the good faith effort extension from for our home health care services EVV implementation. We submitted it to CMS. So if approved by CMS, the extension would allow for up to an additional year for our home healthcare services EVV implementation. That would mean it would extend our soft launch period. And this would not impact PCS EVV implementation. We're considering our PCS implementation completed. This does not impact the beginning of our soft launch period, which started on August 10th of 2022. The year extension would allow additional time for the soft launch period. So that would mean that claims would begin to be impacted on January 1st of 2024 if we are awarded the good faith effort extension. If we are awarded the good faith effort extension for our home healthcare services EVV implementation, that information will be shared in the EVV public meeting, and I'm sure it will go out from other avenues of communication through the department as well. Okay, the Department of Human Services has published the list of Medicaid state plan and waiver services that are identified as home health care services, which are subject to EVV. And the list is available on the DHS EVV website. As a reminder, Medical Assistance Bulletin number 05-22-09, 07-22-03, 54-22-01, 59-22-01, and 00-22-06, titled Electronic Visit Verification Requirements for Home Health Care Services in the Fee-for-Service Delivery and Managed Care Delivery Systems, was issued on August 10th of 2022. So this bulletin applies to EVV for home health care services for all OMAP, ODP, and OLTL providers. Okay. So our pediatric shift care codes were added. So T1002 and T1003 are being added to the MA program fee schedule. These are not actually new services, but they are 15-minute increment versions of the existing codes for S9123 and S9124. And these are for use in the fee-for-service delivery system as of October 1st, 2022. The public notice for this will be published on September 24th of 2022 and will be viewable in the current issue of the Pennsylvania Bulletin, which is located at PA Code and bulletin.gov. Medical Assistance Bulletin 05-22-08 and 07-22-02, titled Additions to the Medical Assistance Fee Schedule for Private Duty Nursing Services provided to beneficiaries under the age of 21. This will be issued on the week of September 26th of 2022, and it will be viewable on the What's New at OMAP, which is located at our provider site. Okay, now I'm going to turn it over to Chuck Frick from ODP, and he's going to kick us off with reporting.
All right, Janice, can you hear me okay?
Yes.
Great. All right, just go to the next slide, please. All right. We're going to talk about reporting capabilities for MCOs and providers. Reports for MCOs and providers can be found in the online manual in the aggregator. These reports can be used to provide information on what has been submitted to the aggregator. You can look on the screen here. Your reports, under daily and date rate reports are available. Reports can be exported to Excel or CVS. These are great. You can see the square there for the online manual. If you click on it, it has some good graphics in there. We want to emphasize one thing though, that not all these reports shown in the online manual are available to Pennsylvania. So just want to emphasize that again, not all reports shown in the online manual are available to Pennsylvania. So okay, next slide please. Details about the data fields on the visit listing can be found in the online manual. Some reports take a while to run, so be a little bit patient, all right? Sandata is working on the improvement for runtime reports. So depending on your system, some system, it could be a little faster, a little bit slower, depending on, your speeds and stuff like that. So be patient on the runtime, but we're working on it, and hopefully it runs fast for you. But we have seen some folks say it takes a little bit of runtime. Next slide, please. The EVV compliance report isn't documented in the online manual yet. This is a newer report. This report will be based on the data currently in the aggregator. This is where you'll find, again, the EVV compliance report. So this is one thing that you'll be monitoring your manual visits and compliance. So this is one of the things that we'll be talking about a little bit more as we go along about reporting functionality. Okay, next slide, please. Alrighty, compliance report example. This is an example of a compliance report. This is private, the private information has been blurred out. This is a detailed report for each visit in the aggregator. A summary in the gray area can be found on the last page of the report. You can save the report and filter the data. If you want to filter on the data fields by employee name, you must include column N in the filter selection. You are able to request a report for a specific client or employee by entering the last name, first name in the client or employee data fields. So this is going to, you could do a lot of searching. You can see like it gives you total visit counts, compliance percentages, and a whole bunch of other information. So again, this is going to give you a lot of good information about your compliance percentages. All right. Next slide, please. Reminder and updates. All right, next slide. All right, this is just the place on the DHS website. We just wanted to, again, for you to be familiar with, to where to look for reminders, where we come out with new information. So when we have new releases that you know where to go to, you should be checking this regularly for updates as they come out. We will also be sending you notices through listservs and other communications as well. So next slide. Again, just another reminder about releases. Sandata communicates via email to provider agencies when staff need to log out during system outages. Providers should review notifications prior to releases and inform staff when they need to be logged out of the system. Again, the Sandata customer care portal is accessible to find the releases. Notes can be found out by the link, the zendesk.com. Again, if you go to that web page before, the releases will be posted there as well. Next slide. Okay. All right, providers using the DHS EVV system should remind their direct care workers to update the Sandata Mobile Connect application following the Sandata Mobile application release. Staff are to communicate with their administrators on issues with their Sandata Mobile Connect or telephonic visit verification. Administrators should reach out to the Provider Assistance Center only when they cannot find resolution to the Sandota Mobile Connect password reset. It is highly suggested all agencies use the DHS EVV system have at least 2 EVV administrators in the potential event of the primary administrator's unavailability. Sandata has completed updates to the DHS EVV system and the DHS aggregator effective August 10, 2022. No actions are needed by the users other than additional trainings mentioned previously. Again, constant training with staff and direct care workers is always a constant. PCS providers using Alt-EV to submit EVV data should be aware that PCS claims and encounters submitted after August 10, 2022 will need to adhere to the updates. Technical specification, otherwise they will deny. Okay, manual edit compliance. All right, DHS is assessing EVV manual edit compliance for fee-for-service at this time. DHS is assessing manual edits compliance rate by program payer. ODP, we do look at, through the claims, our claim resolution unit, OLTL does and OMAP does as well, BPI. As a reminder, providers are expected to achieve at least 50%, that's the minimum, of EV records for verified visits without manual edits. If an EVV visit is missing information or the EV visit information was entered incorrectly and requires any type of edit or correction, this is deemed a manual edit. If a provider manipulates data or adds missing data or changes data in any way after the service is delivered, this is deemed a manual edit. Okay, next slide, please. Examples of edits include, but are not limited to, a caregiver misses a clock in or clock out and the visit needs to be edited to add the appropriate time of service. The visit is unable to be electronically captured at the point of care because of mobile application or telephony are not available. The EVV system's down. It could be the weather. We had a lot of times there's flash flooding or whatever. There's a system power outages. The visit is unable to be electronically captured because devices cannot be used at that point of care. A visit is captured electronically, but cause an exception to be generated. The record would be classified as manual edit. 2-to-1 services with overlapping time in the aggregator for 3 or more workers, typically due to shift changes. Next slide, please. The department continues to perform targeted outreach to provide technical assistance to providers that have either not submitted EVV data or have a high percentage of manual edits. Again, we're constantly looking at it. I think, as time goes on and on, the manual edits are going to be more and more the higher percentage. The EVV compliance report is currently available in the EVV aggregator. We just showed you the compliance report, so that's one of the things we're kind of making more and more reference as we go along. Updates to the report are planned for releases in October 22. So I think that was another thing we just emphasized earlier, to look at that website that we showed earlier and for the releases. So October 2022 is an important date. The report is there, but it's going to be another release concerning that report. So it's one of the things everyone needs to pay attention to. The report allows providers to efficiently determine their quarterly compliance percentage. Providers should self-monitor their EVV compliance using the reports available and work to improve areas of non-compliance. DHS will be reducing the manual edit compliance rate threshold in the future. So we will be reducing the threshold. So 50% will go down. DHS is developing and updating the MA bulletin to reflect the new manual edit compliance rates. Next, okay. ODP has incorporated EVV manual threshold compliance into their claim documentation review process, which is a component of ODP's quality assessment and improvement QA&I process. As any providers who are with ODP, you understand the QA&I process. For more information on claims documentation, there is the link there in the PowerPoint. Technical guides for claims and service documentation. All right, next slide. To ensure DHS can appropriately contact providers, please make sure legal entity information, including contact information, is up to date and correct in all DHS systems. This includes the EVV systems, MI systems, HCSIS system, Promise, etc. All right, I think that was it. So I think I'm turning it over to Aaron.
Aaron, are you on the line?
Yes, hello, sorry. Took a second to unmute myself. Hello, everybody. Here to represent and talk about some recent SANdata training updates that were provided. We conducted a series of 3 in-person trainings in Pennsylvania earlier this in August, from August 16th to the 18th, where we had 36 attendees. And following that, there were approximately 2 weeks of various online webinar trainings that covered EVV topics from visit capture to visit maintenance and client and employee data entry. We had 45 attendees join those various sessions between August 22nd and the 30th. And then we hosted a series of 3 Delta trainings, and the Delta trainings were to cover 4 current personal care services providers to share some information on the differences between PCS and the new home health program that has recently been implemented. So that was very well attended, with 189 attendees over the 3 sessions from September 12th to the 14th. The responses that we got from the training were very well received, with high satisfaction scores. And I do want to share that we are working on sharing specifically some of the Delta training materials on our SANdata On Demand platform that has been talked about previously in this presentation. So when we know more about when that is posted, we will be sure to share with Pennsylvania, and so that that information can be disseminated. Next slide, please. I'm sorry, I'm not sure who the speaker is on this slide.
That's still you, Aaron.
Oh, I'm sorry.
I'm sorry, that was our fault because we kept the header on wrong. This is still a SANdata slide.
Yeah, so for training for agencies opting to use the free DHS EVV is available on the DHS EVV website. And in addition, a variety of training channels are available. So in-person and classroom sessions for administrators, instructor-led webinar sessions for staff, and self-paced trainings accessible on our LMS system, delivered via SANdata's LMS system, as well as training resources available on SANdata On Demand. Next one. Another update that SANdata wanted to provide is a project that's recently been completed to offer the MCO payers in Pennsylvania aggregator portal access. So we have been, administrators within each MCO has been given access to view their data and run reports within the SANdata aggregator. The goals each MCO is limited to the visits related to their own payer account. So any visits that are listed with MCO, they will only be able to see their own visits. And the goal of this project was to allow the MCOs to troubleshoot claims questions that you have of the individual payers, as well as for the MCOs to be able to run EVV visit trend reports to improve the overall provider performance. I think those are my updates.
All right, thank you, Aaron.
Thank you.
Okay, we're gonna go over a few new frequently asked questions that the department has become aware of. We're seeing come across our desk by several entities, so we wanted to share them out here. The first question is, does EVV apply to Medicare crossover claims? So our answer to that is any claims and encounters submitted to our Pennsylvania Medicaid program, which were primarily processed and paid for by either Medicare or a Medicare Advantage plan, are not submitted to EVV processing in promise. Since EVV is a federal mandate, the EVV validation is performed by Medicare or the applicable Medicare Advantage plan. However, claims and encounters which are submitted to Pennsylvania Medicaid, which do not have any cost sharing with Medicare or a Medicare Advantage plan, those are going to be subjected to the EVV ESCs in promise. So hopefully that information is helpful for people who are confused about Medicare claims. Okay, another question that has come up a few times, what is the specific requirement to capture location? So the EVV requirement, that is the location to be captured, I'm sorry, I'm gonna start that one again. The EVV requirement is that the location should be captured electronically. CMS requires verification of location at the start and end of a service. GPS coordinates, which are latitude and longitude, are required for both mobile as well as fixed visit verification or FVV devices. Location is not tracked throughout services provided in the community. The location should be captured when a caregiver arrives at a participant's house to assist with grocery shopping, for example, and again after they return from the store. So please note that if you're entering it manually, 0.0, 0.0 is not a valid latitude and longitude value. The GPS coordinates will be captured in the DHS SAN-Data mobile application at check-in and check-out. The perimeter for locations is set at 1/4 mile in the DHS SAN-Data EVV system. However, even if the recorded location is outside of the 1/4 mile perimeter, this will not cause an exception in the DHS SAN-Data EVV system. The provider will be able to enter multiple addresses where services are provided, and these addresses can be updated as needed. So if an error occurs, any system errors may be corrected through the web portal by an administrator. Okay, another frequently asked question that we've been seeing is, what is the specific requirement to capture location for telephony? And the answer to that is telephony requires the originating phone number and telephony PIN. As such, telephony may only be used with a landline. Okay, I think we're coming down to the tail end of our presentation, so we'll just go over a reminder of some EVV contacts. If there are technical issues such as a DHS SAN-Data account assistance, a welcome kit needs reissuing, account unlock issues for DHS SAN-Data EVV, those kinds of things. If those are the issue, please contact the Provider Assistance Center, which is PAPAC1 at gainwelltechnologies.com, or they can be called at 1-800-248-2152. If there are issues related to HHA Exchange and Community Health Choices billing, then you can contact HHA Exchange at support@hhaexchange.com, or you could also contact the appropriate Community Health Choices Managed Care organization. So any vendors needing to integrate with the CHC MCO HHA Exchange should contact PA Integration at hhaexchange.com. And when there are any issues related to physical health managed care organization claims and billing questions, please contact that appropriate physical health managed care organization. Okay, so for new home healthcare services or new fee-for-service providers who have completed and submitted the new provider enrollment form through the DHS alternate EVV webpage, if you have questions specific to the alternate EVV, you can contact Sandata alternate EVV support team. If you have issues related to all EVV, such as account unlock issues for the DHS aggregator portal, integration status inquiries, or any issues with the DHS aggregator accepting file submissions, you can contact PA Alt EVV at sandata.com, or call them on the phone at 855-705-2407. Okay, if there are any general EVV program issues or requests to be added to the EVV listserv, we're requesting that you contact the EVV resource account, and that is RA-PW EVV notice at pa.gov. Any providers with technical issues reaching out to the Provider Assistance Center or Sandata alternate EVV team should copy the DHS staff on those emails at the same address that I just said above, which is RA-PW EVV issues. Oh, I'm sorry, that's a different email address. So we have an RA account from the department specific to track EVV issues, which is RA-PW EVV issues at pa.gov. So providers with support tickets that they wish to escalate with DHS should reach out to DHS at our RA-PW EVV issues at pa.gov. Okay, so here's some more resources. We have our Sandata EVV customer care portal, which is available at sandata.zendesk.com. And our Sandata EVV training library is available at the link in the middle. Our Sandata learning management system is available for EVV system administrators at sandatalearn.com. And of course, we have our DHS EVV webpage at the link provided at the bottom of the page. And there are DHS EVV Sandata training manuals, all the EVV medical assistance bulletins, frequently asked questions about electronic visit verification, and the ODP EVV technical guide. Okay, so EVV claims resolution contacts. If you have billing issues such as why is an EVV ESC setting, what the EVV ESC means, questions about what is in the aggregator, please contact the following program office claims teams. You can contact ODP Claims Resolution Section at 866-386-8880 or by email at ra-odpclaimsres@pa.gov. And they are operating Monday through Friday, 8:30 to noon, and then again at 1 to 3:30 p.m. For the Office of Long-Term Living, you can call the OLTL Provider Call Center. That number is 1-800-932-0939. You want to choose option 2. And the hours of operation are Monday through Thursday, 9 a.m. to noon and 1 to 4 p.m. For the OMAP Provider Inquiry Line, you want to call 1-800-537-8862. Choose option 2 and then option 6 and then option 1. And their hours of operation are Monday through Friday, 8 a.m. to noon, as well as 12:30 p.m. to 4:30 p.m. Okay, that brings us to the end of our presentation. We're going to stay on the line for another few minutes so that any audience members who wish to enter any questions or comments in the chat box can do so. Just a reminder, if you are going to enter a question or a comment, please reference the slide number that you're talking about so we can look at that slide when we go to respond to the question. We truly appreciate everyone's participation in this September 23rd EVV public meeting, and we hope you have a great day and a great weekend.